Dear audience, thank you for watching this video. My name is Feng Kun from the Penn State University. It is my honor to present my research at the AICR conference. And the title of my presentation is GPR44 mediates the selenium-dependent anti-leukemic effect in acute myeloid leukemia. As you may know, normal hematopoietic stem cells can differentiate into functional blood cells. However, HSCs can also become leukemic stem cells upon mutations. Leukemic stem cells have the ability of differentiation, self-renewal, and proliferation. Conventional chemotherapies cannot target leukemic stem cells, which will result in the relapse of disease. It is urgent for us to find novel therapies which can target leukemic stem cells in order to cure leukemia. Leukemia patients may have various symptoms involved in different organs, and these symptoms can dramatically interfere with patients' life quality. Our lab focuses on the investigation of selenium. We consume selenium from nuts, meat, and vegetables. Clinicians have found low selenium levels in leukemia patients. Interestingly, leukemia patients treated with selenium had better survival. However, we do not really know the exact mechanism of this treatment. To investigate the effect of dietary selenium on leukemia, we generated a mouse model of human acute myeloid leukemia, AML, by transplanting CD45.1 leukemic stem cells into CD45.2 recipient mice through rich orbital injection. First of all, we put the CD45.2 recipient mice on diets for 4 weeks, including selenium deficient diet, 0.4 ppm, 1 ppm sodium selenide diets, or 0.8 ppm, 3 ppm selenomethionine diets. And then we did a secondary transplantation with rich orbital injection of primary CD45.1 AML cells. We put the mice on diet for another 3 weeks to allow them to develop leukemia until euthanasia. Regarding the diet of selenium supplementation, which is sodium selenide, the mice fed on sodium selenide diets had better outcomes indicated by decreased leukocytosis and decreased hepatosplenomegaly. Those mice also had decreased total leukemic cells in the bone marrow and spleen, as well as leukemia stem cells in the bone marrow and spleen. This phenomenon showed up in the selenium-methionine diets also. It indicates that both inorganic and organic selenium supplementation could alleviate the severity of AML in mice. Due to the eradication of leukemic stem cells in the bone marrow and spleen, we could say that selenium supplementation could be a novel therapy for AML patients. Furthermore, we also found the metabolism of cyclopentenyl prostaglandins was activated by selenium supplementation, indicated by increased expression of COX-1 and HPGDS, as well as increased production of CYPG, specifically 15-DPGJ2 in the serum of AML mice fed on selenium supplemented diet. And this effect is more phenomenal in sodium selenide, than in selenium methionine. It tells us that inorganic selenium might be more effective in the treatment of AML than organic selenium. On the other hand, GPR44 is a well-known receptor for cyclopentyl prostaglandins. And we found that AML mice transplanted with GPR44 knockout AML cells had much worse outcome than the mice transplanted with wild type AML cells, featured by increased progression of peripheral white blood cells and decreased survival. In summary, we demonstrated that inorganic and organic selenium supplementation could induce endogenous production of cyclopentyl prostaglandins, and CYPGs can activate GPR44 on leukemic cells, leading to the cell death of AML cells, particularly leukemia stem cells. It indicates that selenium supplementation could be a novel therapy for leukemia patients. Here, I'd like to thank Dr. Sandy Prabhu and Dr. Robert Paulson for their instructions. And I also like to thank my colleagues for their help. Thank American Institute for Cancer Research, Penn State Cancer Institute, and Penn State College of Agricultural Sciences for their support. Thank you for your attention, and I'm looking forward to receiving feedbacks.